get that all the time. It's such a big trust issue, because it's the question, you're coming in being vulnerable. I'm scared. It's what's holding me back more than anything. Just the thought of the surgery and what I'll feel, and post-operatively, how am I going to feel, and the pain. And right now I've got bad teeth infections, whatever, but is it going to be worse based on what I'm doing, and how long is it going to hurt, and those sort of things. So generally I can tell you that the treatment itself is very, very easy from a patient perspective. So we'll take records the first time that we see you. That appointment's 30 to 45 minutes. There's no injections, there's no pain. We'll digitally capture all our information. Once we have all that information, then we can start making plans for the surgery, the final teeth, and how that works. So that typically, there's about 2 weeks from the time I take records till we schedule surgery. Day of surgery, when you come in, basically you'll have some medication that you take an hour before you come so that you're more relaxed when you get here. After you're here, I'm going to start an IV where you'll fall asleep. And then basically I'll do my surgery. At the end of that, we'll wake you up and you'll say, wait a minute, you just started, and we'll be finished. So the surgery itself is very easy. The next day, you can check on some of my YouTube videos, but they'll come in, and the scale of 1 to 10, the patient will tell me it's a 1 or 2 typically. The last 4 in the last week, they were all zeros. It just happened to be that it was that good. And we try to do clean surgeries, be as aseptic as we can. And just the way that we do it, I feel like it's getting better and better all the time, but it's been a really good thing. But I would say on average 1 to 2 out of 10 the day after surgery. And then you're talking about, from that point forward, it's really just letting the bone grow to the implants, being careful with what you're eating, and we can go over all that kind of stuff. But at the end of it, from a pain standpoint, that's really all you're worried about. So part of the anxiety then is trusting, is this the right guy to do this? And validating it's the right person is an important thing to do. I recommend all my patients, you know what? Go get all the consults. Go talk to whoever you feel like might be a great place for this to happen, but let me be one of them. Come by and let's talk about it, because this is all we do. And it's the confidence that you have from doing this all the time probably separates us from a lot of the other options. It's the challenge for a lot of patients is how will I know, or when will I know this is the right place? And most of the time after the consult, it's like, you know what, I've gone to the other places. I know this is where I want to do it. And I think it probably starts with a concept of, you always start with the end in mind. Where do I want this case to finish? And then I'm going to work backwards from that, so that I hear, what is it that you want? And is it something where you're snapping in your teeth on implants? It's a great option. There's benefits, and there's some things that are less ideal with it, but those are in the options video that's in my YouTube and on the online. If you go to the website, Oklahoma Dental Implant, dentalimplantscenter.com. You can go to that and go to the options video, and we talk about some of that. But it's really, what's the right solution for you? What is it that's keeping you from being all of that? Figure out what that treatment plan is, and then work back from that. So once we've done that with a patient, we sit with a patient through the consult where we have an idea, they know what the options are, they know what price points are, because everybody wants to know the cost, and we're going to go over that. You're going to know exactly, in your situation, with how many teeth you have, the bone situation, everything considered, we're going to give you numbers for all of that. There's nothing hitting. I just won't know for sure to tell you an exact amount until I can take a three-dimensional image on you. So all of those things are part of the process for us coming to how we reduce the amount of anxiety that you have. And I haven't had a patient that came back and go, this wasn't worth it. I'm sorry. I wish I hadn't spent the money on this. There's just not that reaction to it, because I see all the emotion of, what is it after? And that leads